Education is an important part of growing up, but sending small children off to school every day can be a bit stressful for parents.
I think my biggest concern is for their emotional safety and for their physical safety.
As the saying goes, it takes a community to raise a child, and as parents, there are many factors to consider to help keep all kids safe while they're at school.
As I'm packing their lunches in the morning, I try to think about the fact that there are peanut allergies, which are very serious. As well, my children have dairy allergies, so trying to find things that are safe for everybody that they might have lunch with, as well as safe for my own child to eat, is a challenge and something that I think about quite a bit.
As you're sending your kids back to school, one of the big things that you worry about, especially children with anaphylactic type reactions, is that they have their devices that treat anaphylaxis. So there's a few different devices out there. Some actually talk to you. They're an auto injector, so it injects right into the skin automatically. And what we need to remind parents, caregivers, teachers, lunchroom supervisors is how to use the devices and how to use them properly. Also stocking up your medicine cabinet, so kids are going to start playing on playgrounds, there's going to be falls and hurts and that, so needing things like Band-Aids, painkillers, any types of products in your medicine cabinet that would be useful if your kid is getting hurt on the playground. Lice is always something it's going to be there, it's always been there, and so at any given time they say about 10% of school kids have it, so about 2 million Canadians have head lice at any given time. It's not really going to do anything in terms of harm to you, it's more a nuisance, so it's not a health situation or anything like that, but who wants a kid to have head lice, right? So if you do get a letter from the school indicating there has been a head lice infestation in the school, there is a new product out that it's called the NitView, and what it is, it's a UV LED light that combines with a metal comb on it that you can use to kind of detect not only head lice in a child, you can also use it for bed bugs, for fleas on animals. And then if we can detect those quickly and then use the comb to break free the nits from the hair shaft, it's a metal comb which is more sturdy than some of the plastic combs out there. If we can kind of get rid of the nits or the eggs from these, we can kind of prevent further hatching of the eggs and then prevent further infestation as well. So you can always come in and talk to your pharmacist about any kind of issues that your child has with going to school. So from any health condition, pharmacists are always readily available. They're easy to talk to and they're a good source of information.
And let's be honest here, since there's no manual for raising your children, parents can always use all the help they can get in dealing with their kids' playful curiosities.
My son the other day, he literally put his mouth over top of a doorknob. I was like, what are you doing? And so it's things like that, when they do things like that, it makes you very nervous about how they're going to behave and take care of themselves when they're at school. So when they get home and they're safe, that is a big sigh of relief that they've made it through the day, there's no bumps and bruises, that nobody got sick, and everyone is safe and everyone's happy.
For Go in Calgary, I'm Shiva Jahanshah.